friends, I'm Dr. Davidson. Today I'm here to talk to you about dairy and disease. Now, many of you may have seen advertisements such as TV commercials extolling the various health benefits of dairy products like cheese, milk, and yogurt. However, if we look at this actual scientific evidence, it's very clear that consumption of dairy products is very detrimental to health. It is harmful to health to consume dairy products. And I'm here to talk to you today about 3 reasons why dairy is the worst for babies and kids in particular, and for human beings in general. I'm going to do it all in just 5 minutes. So many parents are familiar with colic. It is a very miserable state because not only is it painful for the baby, but it's also extremely stressful for the parent and can lead to interrupted breastfeeding, postpartum depression, and other complications. It's thought to be caused by discomfort from air that the baby swallows when either breastfeeding or drinking from a bottle. The problem is that there are no effective remedies for this problem. The leading drug treatment, simethicone, which is commonly used for gas, has been shown no benefit in colic, and natural products like peppermint oil and herbal teas have safety issues, and therefore parents are advised not to use these in their children. What about burping? Well, the scientific evidence is clear that burping has no benefit for colic. Quite the contrary, actually burping causes more regurgitation without easing colic at all in children. It was well known back in the 70s that milk protein, a substance in milk protein, can cause colic. So in this study, scientists theorized that this cow's milk protein was transmitted from the mother's milk to the baby through the breast milk. And so they did a randomized trial where they basically eliminated dairy from the diets of mothers who were breastfeeding. So what they found was of 19 infants, the colic disappeared promptly from 13 out of the 19, and in 12 of those 13, they were able to show that they could bring back the colic by reintroducing the dairy back into the mother's diet. In other words, if you take the dairy away, the colic disappeared, the baby stopped crying. As soon as you reintroduce it, the baby starts crying again. So this kind of evidence is very compelling, and it provides a clear indication that removing dairy products from the diet of the mother and therefore the baby is a effective treatment for colic. So beyond this, there was a study in the Pediatric Gastroenterology and Nutrition Journal regarding the opiate-like compounds found in dairy. And these compounds are collectively known as casomorphines. They are opiate-like compounds. In other words, they are like narcotic-like compounds that can cause respiratory distress in infants. And it's no coincidence that morphine is part of their name, casomorphine, because basically, just like morphine, they can be kind of addictive. They make you crave more of this milk or dairy product, and they're quite dangerous. The reason we're so concerned is about 7 to 10% of infants with recurrent apnea episodes. In other words, episodes where the child cannot breathe. 7 to 10% of those infants cannot be saved, and they die of sudden infant death syndrome. Now, sudden infant death syndrome, or SIDS, is actually the leading cause of death in infants after 1 month of age. And sadly, 1 in every 2,000 Americans, 2,000 American babies die this way. The most vulnerable are the infants exposed to several risk factors, such as sleeping on their stomach, secondhand smoke, and high sleep room temperature. The research suggests that in some cases of SIDS, it's cow's milk that may play a certain role. And it's suspected that these opiate-like casomorphines hold direct responsibility for that situation. Now, it's also there were also studies with regard to autism, and it was found that whereas the human casomorphines, in other words, the compounds in human milk, are actually associated with normal psychomotor development and muscle tone, in other words, with normal childhood development. In contrast, the compounds in bovine or in dairy products, these casomorphines can lead to delay in psychomotor development and muscle spasticity. So the evidence suggests that the inability of some infants to adequately eliminate bovine casomorphine may be a risk factor for delayed psychomotor development and other diseases such as autism. So I'm going to wrap up by telling you, kind of dispelling some of the myths that you may have heard about dairy products. One is that dairy products are a good source of calcium. Now, the reason that they are actually not a good source of calcium is because the calcium in dairy products is trapped in a type of matrix, and it's very hard for the body to absorb it from this matrix. Now, beyond this, even if this calcium can be absorbed, dairy overall, again, has many thousands of compounds, and many of these are actually detrimental to human health. So there's no reason to get calcium from something like dairy when there are many healthy foods that actually contain even more calcium. For instance, like green leafy vegetables, beans, and many others. So the other myth you may have heard is that yogurt and fermented dairy products like kefir contain probiotics, which are beneficial. The reason this is a myth is because the probiotic levels achieved in these products is beyond anything that required to produce a beneficial health effect. And actually, to achieve a beneficial health effect, you would have to get a certain concentration of the beneficial organisms, which products like dairy and kefir simply cannot achieve. So I hope this has been helpful to you. This has been a presentation regarding pediatric nutrition and the links between dairy and disease. Thank you so much.